Recording.
You're recording already?
Yeah.
Oh, well, throw that vacuum down, Becky. Yeah.
Okay, y'all. So this is an informative speech on seizures. So we'll start off with there are different types. The most commonly known are the ones that cause the actual muscle spasms and end up laying on the floor. And most of those come from epilepsy. There are also non-epileptic seizures that come from injuries most of the time, and they can can come from partial brain spasms, where only a portion of your body will be affected because only a portion of your brain is sending out the signal. Then there's also the generalized, where your entire brain is sending out the entire signal of the seizure occurrence. The symptoms can include, for the person themselves, sudden fear or anxiousness, a feeling of being sick, dizziness, a change in your vision if anything starts to get blurry out of nowhere, a jerky movement to the arms and legs, or an out-of-body sensation or headache. And if a seizure is in progress from an outside view, if you see somebody losing consciousness, falling to the ground, uncontrollable muscle spasms, drooling, or even frothing at the mouth. For the person themselves, having a strange taste in their mouth, clenching their teeth, biting their tongue, rapid eye movements.
Nancy does that a lot, by the way.
Unusual noises, losing control of bladder or bowel function, and having sudden mood changes. The causes can include alcohol withdrawal, bites, stings, brain infection, brain injury during childbirth, brain defect present at birth, choking, drug abuse, drug withdrawal, electrolyte imbalance, electric shock, epilepsy, of course, high blood pressure, fever, head trauma, kidney or liver failure, low blood glucose levels, or even a stroke. It can run in families, so be cautious with that. The effects from the seizure, it tends to affect your brain, and it'll continue throughout your life most of the time. Any of them that are coming from injuries or illnesses, though, can be treated. And doctors have difficulty diagnosing what the seizures come from. Oftentimes they have to use imagery scanning, where they can catch different movements or things like that in your brain. They can also do blood tests for imbalances in your electrolytes, a spinal tap for infection, and toxicology screening for tests for drugs, poisons, or toxins. They are treated with medications, surgery to correct any brain abnormalities, nerve stimulation, or even a special diet that's known as ketogenic diet. Sometimes you can only reduce them, you can't stop them. How to help somebody? The seizure lasts longer than 3 minutes. Stay with the person. If they don't. Okay. You're going to check them for injuries, because oftentimes they fall or hit things with their muscle spasms. If you can't turn them onto their side during the seizure, do so when the seizure is over. Try to clear their mouth of any saliva or vomit that occurred, so that they can open up their airway. Put a cushion under their head, make them comfortable. Don't offer them anything to eat or drink until they're fully conscious, so that they don't choke on anything. And then once they are coming to consciousness, make sure to ask them normal, everyday questions that they should know about themselves or where they are and things like that. For people that live with epilepsy, it's really important that they teach people that surround them how to look for the symptoms when seizures are starting to occur, because they can cause death. Find a really good doctor that makes you feel comfortable, so that you're not scared to ask them questions and they're not scared to talk to you about possibilities of uncomfortable situations, or risky situations. And find a support group. As with everything, it's important that you surround yourself not only with people that you inform about it, but people that live with it every day. Trying to prevent them, you get plenty of sleep, eat a healthy diet, exercise regularly, engage in stress-reducing techniques, there's those little balls, and avoid taking illegal drugs. I have a few photographs. This one shows, this would be from a partial seizure. Only a portion of your brain sends out the signal. And this is supposedly a partial seizure, but I think that's just different portions of the brain it comes from. This one would be the full primary generalized one, where your entire brain sends out the signal. This is often the start and end of a seizure attack, and then they end up on their side when they get fully conscious. And for things that you can do, like I said, put a cushion under their head, any tight clothing if they're wearing like a tie or anything, loosen that up, turn them onto their side, time the seizure so that you can inform the doctors that take care of them afterwards. Don't put anything in their mouth, food, drink, anything like that.
Like the electrical seizure? So it's how like the
Yeah.
seizure.
Look for an ID. A lot of times they'll have some connection to who can take care of them or who you should contact outside of 911. Don't hold them down. Let their body have their shakes. And then once it ends and they're up to consciousness, offer them help. See what they know that you can help them with. The end.